Hi everyone, welcome back to my channel. I'm here today with the gorgeous, obviously also supremely intelligent Dr. Sam Bunting. How's that for an intro? They don't say that on telly, do they?
I feel warm and fuzzy inside.
Thank you for all your questions on the blog. You inundated us with cues you would like me to put to lovely Dr. Sam. Can we call you Dr. Sam?
You can call me whatever you like.
Oh. They are predominantly acne heavy, let's be honest.
Okay.
It's pretty much fixed my acne. But what we thought we'd do is split it up into lots of top 3 tips, a few little how-tos, so that if you aren't interested in rosacea, for example, you can just click on the link at acne and vice versa. So to be a prelude, bit of an orchestral maneuver there, but anyway, to all of that info, if you can tell us, Sam, a little bit about your background and how you ended up doing skin.
So I trained at Cambridge, UCL, did all the usual medical training and practiced medical dermatology for many years. I always felt a little bit dissatisfied with how that meant you approached patients. I'm a very aesthetically driven person. My first word was literally shoe. And you know,
mine was Liverpool Football Club. One word.
It's become shoe, right?
It's,
no.
Well, I've got such huge feet. This is what it's like when you talk to girls. You just digress. I'm like a size 9, 10 in trainers.
I have a theory that shoes are football for girls. It's our common ground. You know?
It is. No, I can appreciate. But sorry, carry on.
Anyway,
I digress.
that's fluffy, isn't it? So, you know, not able to fix people in a complete way. So I found that dissatisfying, and I also saw that the UK hadn't yet really gone down the route of focusing on cosmetic dermatology in the way that the US had.
It still hasn't really.
It still hasn't fully embraced it, and that's partly due to the low number of dermatologists per head. Anyway, so I made a big choice to move out of NHS practice into private practice, and organically found this niche, this idea of correcting skin conditions that are often not taken perhaps as seriously as people would like them to be. Conditions that cause a lot of heartache, suffering and misery, often for decades.
Yeah.
You know, acne is the commonest inflammatory disorder of the Western world.
I'm so glad you said inflammatory disorder.
It is, it's a disease, you know.
I'm so glad you said that, because my beef with some dermatologists, doctors it's much worse. Your average GP send me into a rage because all they do is prescribe antibiotics. The amount of girls who come to me who've just been, and boys, who've just been given antibiotics for years and years and years and years, and I'm like, it's not fixing it, please stop taking antibiotics. But the fact that you immediately say it's an inflammatory disease is like, oh, finally.
Exhale. You know, and I think it's the fact that, you know, just a few spots before your period, which is a terribly common scenario, and maybe 70-80% of women experience that. You know what, that's a quarter of your reproductive life spent anticipating spots. So I guess my feeling is that if it is enough to bother you, then I should take it seriously. Exactly. So there's this notion of correction, and then the natural thing once people have corrected a problem like acne is they want to enhance their skin further. There's often, you know, little changes to tidy up from acne they've had from the past. So the beautification process. So that's kind of how that idea came about, and it really seems to have resonated with women who finally, as you say, feel the sense of relief that someone's actually
listening to them and taking them seriously. Because acne, I know from all of my lovely readers who, the predominant questions we receive were about acne, but rosacea is quite heavy at the moment as well, but obviously I think that's more weather driven as well, given that we would exacerbate it in these conditions. But acne in particular, and also the scarring that's left over, you know, if you don't have access to a dermatologist and you're reliant just on your GP, you are very rarely taken seriously. You know, and the reason I wanted to talk to Dr. Sam is because I'm always asked for recommendations, and I know I have girlfriends who say Dr. Sam saved my face and therefore pretty much saved my life. So that's kind of, that's what you got into it for, isn't it? You know, if that's what you want to do.
You know what? It's a tremendous feel-good factor, and it never gets boring. And And it's not to say that other doctors, GPs have a terribly tough time of it, and I do
Oh,
understand
completely.
that.
Don't get me wrong, I love the NHS, I love my GP, but I'm not going to him with acne.
No, and I think the reality is that we have a luxurious position when you see someone in the private practice. You've got the time, you can afford to give them the support to keep them engaged, because you know what, the first 6 weeks of any acne treatment pathway is a bit of a leap of faith, really. It takes time, and it takes that person to believe that you're giving them the right advice and you're supporting them along the way before things often turn the corner. So I feel privileged, and I think I'm more like an acne personal trainer than anything else, but you know what, that approach does get results. Not that I'm necessarily prescribing anything that's magically different to anyone else, but it's the approach.
But you're looking at the whole picture. And the fact that you said
lifestyle
inflammatory, I
factors.
swear to you, Sam, I have never heard a dermatologist say that word before. Any of them.
Well,
Any of them. So praise the maker. So let's, before we break off into sort of little subsections, I would like to ask you. Oh, no, you should see the questions. I just want to get from you. I'll tell you so for example, I get a lot of people to me who say they have acne and they want Roaccutane, and I think I've literally only sent someone to a dermatologist 3 times in my entire career for Roaccutane, when it was so obviously something major, something systemic that needs a prescription and needs a doc. I just, one woman sat down in front of me and she had perfectly clear skin on her face and chest, and I said, "Why are you here?" And she said, "You need to look at my back." And her back was just covered. And I just said, "You're in the wrong place, you need to go and see a proper doctor, and if your GP does not listen to you, beg for a referral, save up and go to a derm." So for me, Roaccutane has this sort of scare factor, but it does work wonders. So I wonder, from your point of view, when do you think, and one of the questions we had was, when does it become less about what product can do to help me, and when someone walks in, do you go, "You need Roaccutane," or you need to take that step? How bad is it before you go, "Sit down, we need to talk"?
I think there are those cases that walk in the door and it's obvious, and any process that is severe enough to cause scarring, unless there's a good reason, Roaccutane is in the equation. Of course, it's a complex dynamic. It's about not only the skin but also their history in terms of what previous problems they've had from a medical perspective. So all of that needs to be taken into account. It goes on the menu of options. And I agree that bad truncal disease, as we call it, when it's on the chest and the back, can often, again, warrant Roaccutane perhaps in a way that you might go straight to that rather than considering other options. And then I think it's those who failed other kind of standard measures, multitasking with oral and topical treatments, and it hasn't worked, so you're still concerned that there's a risk of possible scarring or significant post-inflammatory pigmentation, the dark marks that everyone hates. Or genuinely, if someone's in a job position where actually their skin is impacting on their career.
So it's not necessarily that it looks that bad, but to them it's a major issue. And
it's causing instability and unpredictability, which is potentially affecting their livelihood. So I think there are lots of situations where the psychological interplay of the clinical findings and that individual, actually you make an informed decision about what you're going to do in terms of the treatment options. In my experience, where you prescribe it for relatively mild disease, you do end up with potentially the side effects having a much more negative impact on quality of life, and that does make you think, okay, well perhaps this was the wrong instance to prescribe it. So I think as a physician I'm always learning and evolving the way I make clinical decisions, but it takes time and it takes exploring that whole relationship. And oftentimes it's an idea that we sort of just put in place to marinate for a while we do other things.
Of course.
But we've, okay, this is plan A, but actually we've got plan B and plan C lined up as well. I think you always have to have that, some sort of contingency with acne, because sometimes it doesn't go to plan.
No, acne's a bugger.
And that's life. It requires a strong therapeutic relationship with your patient.
So, okay, so let's just extend on Roaccutane just while we're here before we sort of siphon off. Are there any instances where you wouldn't recommend Roaccutane because of other things the patient in your case has going on, i.e., you know, in the stories about it, especially in young boys, leading to depression and all this sort of thing. What are the sort of major contraindications, I suppose, is my question, where you would say, do you know what, for you, I'm just not sure, even though your acne is severe and it's troubling you, is there anyone you've actually said, I don't think it's a good idea?
You know,
I'm more trying to put people's mind at ease than get them excited to saying, oh no, it's terrible.
Sure. I think more often than not, that's, you know, the teen who may have had a history of anxiety, those are patients that come in with parents, and it's almost like they've already kind of
Brace themselves.
they already have, I think, already had the conversation between them, or, you know, because often kids with acne that bad, they'll have had friends at school who've had Roaccutane. They'll often have almost made that decision for themselves, you know. So I think it's always about the objective, this is what your skin needs, but actually subjectively, if you don't feel confident about it. You know, kids have got exams coming up, really big life-changing events ahead. Sometimes it's, you know, that's not the right thing to do, or at least it's not the right time to do it. You know, I take scarring very seriously. You know,
so do my readers.
You know, we prescribe retinoids, systemic retinoids for other skin conditions like psoriasis, for instance. And yes, there is this association with depression with Roaccutane, and I think it's you know, a valid concern. But I think that actually patients who have a psychiatric history, who have really terrible skin, oftentimes those who've got that sort of support in place already may well be the safest person to prescribe it for.
Totally.
So I think there are no hard and fast rules.
Yeah.
I think every single patient requires assessment and judgment
individuality.
their own merits, absolutely.
Because I always found, I mean, I spoke to a woman at a conference recently who said that her teenage daughter was so depressed with her skin that she didn't want to give her Roaccutane because she was worried about the depression. And I said, but if she's depressed about her skin, once her skin starts to improve, maybe that vicious cycle and circle will sort of be stripped away, and the depression that could come from taking Roaccutane won't be as big an issue for her as actually how bad she feels about looking in the mirror every day.
And I think that's very true. I mean, oftentimes you'll see these kids come in and they stare at the floor, the hair is arranged all over their face.
Which makes the grease on their face, makes it even worse, and you just want to bless them.
I know, and you slowly but surely see that transformation take place over months, and the self-esteem comes, and the posture improves, and the engagement, the eye contact gets better. So there's no doubt that acne causes a tremendous amount of depression and impaired quality of life, and treating it is an absolute joy when it goes well. But as I say, it's about tailoring the right treatment to the right person with the right support at home and all the rest of it.
The whole caboodle.
Absolutely.
Perfect. Right, we're going to break off and do a lot of sort of little, well, basically I'm going to pick Sam's brains while she's sitting here for us. So thank you for your questions. I hope that was a little bit helpful, sort of more insightful into who Sam is and what she does and the whole acne Roaccutane procedure. And we shall be back with more, probably actually on the same day. Thanks.